Hello, everybody. Good to see you all. Hopefully, everybody enjoyed the weekend weather. It was very nice outside. A little hot today, but better than snow. So we have 2 days worth of data to go over. So we'll go through that and then take some questions. Unfortunately, over the last 48 hours, we've lost 4 individuals in hospitals. 2 on Monday and 2 earlier today. 2 Caucasian females, they're both in their 90s. 1 Caucasian male in his 90s and another Caucasian male in his 60s. Our updated number of neighbors we've lost through this period of time with COVID-19 is now 123 combined. So if we could just certainly think about these folks and their families in this period of time, and everyone else. I know we just had Memorial Day, and I know many people were thinking about the loved ones that they've lost to this virus. Related to testing, there's now been 31,424 tests. 30,009 have been returned. 508 returned since Saturday. There are 1,959 positive cases since March 16th. That's 76 cases over the last 48 hours and 28,050 negative results. We have sent 828 tests over the last 24 hours. We have 1,156 tests pending. Overall, since we started testing before March 16th, our infection rate is now at 6.6%. That has changed. It was symptomatic testing only for a period of time. Then we started proactive testing in assisted living facilities and independent living facilities. And now we are just doing complete proactive testing as well as symptomatic testing still. So at different points of time, the criteria has changed, so that skews your data. Over the last 3 days, from the New York State Department of Health website, the eClair system, we have averaged in Onondaga County 1,231 tests per day coming back in. When you factor in our last 3 days of positives related to those tests, our infection rate over the last 3 days has been 3.3%. We are doing universal testing at the Syracuse Community Health Center this week. We have 3 days of mobile testing scheduled. Tomorrow we will be at Lafayette High School from 9 to 5 in the town of Lafayette. On Thursday we will be testing at the Syracuse Community Health Center on East Genesee Street from 9 to 5. And we've been working with Mayor Walsh and his team on different sites in different areas in the community, and we will be going out to suburban communities as well as we're starting. But on Friday, we will be doing testing at the Valley Plaza on South Salina Street in my old county legislative district. So 3 mobile testing, our mobile testing site going to 3 different locations around the county. And we'll continue to do that each week. And certainly the Syracuse Community Health Center on Salina Street will be available for testing as well. Regional testing, again, working a holiday weekend. We still had some pretty good numbers. 1,131 tests yesterday. Our 7-day average from May 19 through May 25, 1,034 tests. Again, still exceeding 25% of what we need. And keep in mind that Sunday we only had limited hours. Monday, no hours in many of these cases. So certainly that average will increase again as we start to ramp up testing now that the holiday weekend is over. Hospitalizations, 85 individuals in the hospital. We have 41 individuals who are waiting to be released from the hospital. Again, on Saturday, I spoke to Governor Cuomo about this issue. He's recognized it. We're coming up with a plan to get these folks either in an isolated facility or transition a nursing home into kind of a COVID nursing home, so that these folks who are waiting to test negative have a place to go other than a hospital room. Right now, these are folks that have either recovered or are well enough to go back home into their home being a nursing home facility, but they haven't tested negative yet for COVID. That could take an extended period of time. So these 41 hospital beds that we have some of our residents in who are ready to go home from the hospital, and so we're working towards that. Hopefully we'll have this ironed out midweek this week being Thursday, hopefully, as it is a Tuesday today. Looking at the individuals that we do have in the hospital, we have 16 individuals in critical condition. Again, please keep these individuals in your thoughts and prayers. These are folks who are in a big fight right now with this virus. 49 of our hospitalizations are Caucasian, 21 are African American, 5 are of another race. 10 individuals have declined to share their information with us. To date, we have 227 people that have been released from our hospitals. Looking at our positive cases, again, 1,959 positive cases now since March 16th, up 76 since Sunday. So we have today's data and yesterday's data in there. Looking at these numbers, again, asymptomatic cases, especially in our senior facilities where there's been COVID. Many of the employees now testing positive asymptomatically. So that's a trend we've been seeing. Again, we're still getting some asymptomatic cases in the community spread at large. So we need people to continue to be smart with your health, your family's health, and respect the health of your neighbor. Please, when you're within 6 feet of each other, wear a mask and physically distance whenever possible. It's the smart thing to do. When we look at breakdown of our 76 cases, 41 of them related to senior living facilities, 9 household contacts, 26 over 2 days community spread. So 13 community spread a day over the last 2 days. Very good numbers there. We need to continue to be very diligent moving forward as the weather continues to be nice and as we march towards phase 2. We now have, let's see here, related to 1,013 recoveries in the community. This is up 19 since Sunday. And we have 828 active cases right now in the community. So 1,013 recoveries, 828 active cases. We now have 1,922 people in isolation and or quarantine. Related to our cases, 1,160 female, 799 male, 86 under the age of 19, 324 in their 20s, 244 in their 30s, 244 in their 40s. Wow, look at that. 315 in their 50s, 253 in their 60s, 195 in their 70s, 183 in their 80s, and 115 in their 90s. Breakdown by municipality. City of Syracuse, 1,081 cases, 510 recoveries. Clay, 154 cases, 103 recoveries. Onondaga, 133 cases, 35 recoveries. Geddes, 104 cases, 30 recoveries. Salina, 86 cases, 57 recoveries. Manlius, 69 cases and 55 recoveries. DeWitt, 73 cases, 53 recoveries. Cicero, 64 cases, 37 recoveries. Camillus, 61 cases, 38 recoveries. Lysander, 37 cases and 27 recoveries. Pompey, 26 cases, 22 recoveries. Van Buren, 25 cases and 9 recoveries. Skaneateles, 15 cases and 15 recoveries. Lafayette, 7 cases, 3 recoveries. Marcellus, 7 cases, 6 recoveries. Elbridge, 5 cases, 2 recoveries. Atisco, 5 cases and 5 recoveries. Spafford, 3 cases, 2 recoveries. Fabius and Tully, both with 2 cases and 2 recoveries. Restart, we had a nice weekend out at the zoo in Oneida Shores Beach. Really, the process worked well. Positive feedback, no complaints. From the operations standpoint, things worked very well. Very happy with that moving forward. And certainly our libraries have opened up their essentially takeout, carry-out book service today. So we'll have some reports on how that worked out tomorrow. Wanted to remind people as we get into new phases of Restart, our daycare program through Child Care Solutions, 315-446-1220. Again, we have slots available for employees who have a gap in daycare because their children are usually in school right now. Please reach out to Child Care Solutions. We can be helpful. This is a free of charge service through the month of June. And certainly 211 for social, emotional support through this process. It's been long. It's been trying. We've been tested. And if you need help to talk to somebody who can help you with strategies or referrals, please reach out to 211. Questions? Friday, phase 2. Yeah. Barbers. Yeah. I think much of, you're talking about phase 2 being probably your biggest adjustment with density in the community. So you're going to have your back offices, think of law firms, think of financial services, your buildings downtown back to life. Again, this is when they can start coming back, but doesn't mean that you need to bring back your employees all the time. Real estate opens up real estate, so the limited capacity can open up. Looking at retail now opens up more from curbside to retail establishments now being open more, so that's going to bring back more employees. So phase 2 is aggressive, and that will be us. We're going to beef up our contact tracing. Right now, our health department contact tracers have been essentially carrying the load. We're going to give more of our Johns Hopkins contact tracing graduates an opportunity to get engaged moving forward, anticipating that we might see upticks in community spread cases in phase 2. So we'll be doing that as well. But it's certainly going to be more businesses coming back to life, more people down here, downtown. You'll see a lot more people walking around, and that presents a challenge. It also presents more economic activity, and some of our businesses, restaurants that have been surviving on takeout, you're going to have a lot more consumers down here too as well.
Would you give a grade to the community for how it did social distancing Memorial Day weekend?
A couple days I'll give that grade, but I think overall it was, I think, a successful holiday weekend. I think from phase 1, we now have enough information on how this virus is impacting the community at large. The spread numbers maybe ticked up a little bit, but nothing substantial. Our new 7-day rolling average numbers are really nice. So I think overall, we know more about everything today than we did when this started. And so I think that bodes well for us moving forward, that we know the virus is here. We know how easily it can really jump from human to human. So let's just do what we know works, and we know what works. So I think going into each phase, we need to continue to practice that, and that gives our medical community more and more time to deal with a vaccine and to deal with antiviral treatments, and to really understand more about what this virus, how it behaves, I know that many of our doctors and scientists are probably looking at these asymptomatic cases now very curiously about trying to figure out exactly how contagious is an asymptomatic individual compared to a symptomatic individual. We don't know the answer to that, so we're under the presumption that they're as contagious.
How, and you get a lot of emails. Any complaints stand out to you about this weekend?
No, same types of complaints that we get all the time. As we get into, certainly we're going to still see the physical distancing complaints as they happen, as long as we need to distance physically. And it's no shock that with warm weather, will have an uptick in violence. And so that will lead itself to more physical distancing types of complaints. But we think the fact that, we brought more venues online helped spread out density over what was probably the nicest 2 or 3 days worth of weather we've had in a while. Yeah, I think we're going to get guidance from for the phase 2 businesses in short order here for them to go and attest. And I'm sure the governor is going to communicate in some way that, look, phase 2, here we are, 14 days. And I think even the governor and some of his rhetoric over the weekend may have even hedged on future phases, how many days it takes to get into it or not. So we'll continue to go there. But on our, looking at all of our conversations with the state, our region's doing very well. The governor understands the unintended consequence of his executive order in the hospital numbers now. And so he's asked us for our help, being the regional leader in Central New York, the largest county, to try to get these folks out of the hospital and get them into an area where they can still get excellent care, and then while they wait to test negative, to get them back into their homes.
Speaking of the governor, Saturday was your first call with him through the pandemic directly?
Yeah, I think we played games of phone tag, but yes, Saturday I spoke to the governor for the first time.
And I know you mentioned even Saturday that the big topic was this hospitalization rate based on his executive order. Did any other Central New York topics come up specifically with the governor? I'm looking for you to take us inside that conversation a little bit.
Well, it was myself and then the other 5 large counties across the state related to this topic. And certainly I think the governor gave good news to the Hudson Valley about when they were going to start, and Long Island about when they were going to start on the call too, if they hadn't already heard. So I think that was nice news for them. These are communities that haven't even started phase 1 yet, so that was meaningful news for them. And it was a nice phone call, and those are nice to have. And we've been speaking with the governor's team throughout this process, but it's good to hear from him and see how he's doing as well.
Any Central New York specific topics?
Yeah, they're not necessarily shared on that, but I had some offline conversations with some of his other team related to that. Yeah, I think one of the things we're looking at is either transitioning one of our COVID unit facilities that have quite a few COVID units in it to either a COVID unit nursing home or a transitional wing of a hospital or a facility that can be a transitional facility that can still essentially meet the needs of these 41 individuals who are now better and they don't need to be in a hospital. So the key being you want those beds open for folks that need them. And right now it's kind of it's a moment in time thing. We just don't know how long these folks will continue to test positive. It could be weeks, could be a month or so. So right now these are the rules. We recognize that we got to find a temporary solution to this, and that's what we're working on. Not yet. We're working at it, coordinating it, asking different partners to consider that.
What would the legal mechanism for that be? Would the governor amend his executive order? Would he just give I
think he actually came out with an amendment over Saturday or Sunday on this topic, which essentially leads into the solution being what we're talking about.
With so many of the positives being asymptomatic, what are you doing to make sure that people, when they're released from quarantine, aren't just asymptomatic? Has that changed at all? Like isolation?
Yeah, so isolation, your guidance on isolation now has changed, but that's the same, whether you're symptomatic or asymptomatic. So essentially, if you're asymptomatic and you're under 65, you're going to need to show improvement in your health and no temperature for 10 days. So if you're asymptomatic, essentially you're just in a 10-day quarantine. Additionally, if all things progress. If you're symptomatic, it's the same thing. If you're over 65, so if you're an employee at a facility, a senior facility, you tested asymptomatic, you're over 65, you're now, I would have to see if there's any special rules because you work for a essential healthcare facility, but my understanding would be you would then have 2 weeks of where you would have to continue to be asymptomatic and not have a fever. So nothing, what this looks like is the reality that we found asymptomatic cases, remember, when we tested in assisted living facilities. Why did we go there? Because we knew we went to the buildings first that we knew had COVID cases. So it looks like, and it makes sense, these are facilities that have had a lot of COVID patients. So the fact that there may have been light exposure or a lot of exposure to staff, but their bodies have fought off the virus well, is probably not so much of a surprise, but startling how many people are asymptomatic. Whereas in the community at large, too, again, that's a trend that we want to continue to watch because certainly we don't know enough about, if you're asymptomatic, how contagious you are. So that's why you see the quarantine numbers going up, and as we find these asymptomatic cases, and the the reality is that by doing the testing we're doing now, we're finding them, we're finding the cases, and that bodes well for us to get out stronger on the other side of this.
Are you testing everyone who's quarantined as a contact of those people?
No. So if you're a contact, you're in a quarantine. If you develop symptoms, you can get testing then, or in some cases, if you develop obvious COVID symptoms, you then become one of our COVID contacts. If it's obvious, going and getting a test is, in some cases, isn't even necessary. We just treat you like you're COVID positive. Yeah, I saw the article. I'll give it a second read to understand the logic on it. Certainly, we're a big proponent for businesses in general that are struggling, and they may have aspects of their business that can be performed out of phase to allow that to happen. We've talked about gyms, we've talked about other things that may be phase 4 overall, but are there ways that you can do things within that business safely, so you could do at least one aspect of your business earlier in phase 2 or 3? So we'll look to see what Sky Armory, I was confused a little bit because I think they mentioned that they don't have weddings to do right now. But so it really, by the time they had a wedding, they might be in phase 4 anyways, which would be the appropriate time, at least from our details. So we'll review that and understand more the logic behind it.
Have you gotten an update from the Syracuse Community Health Center today? I drove by and it seemed busy, but I'm not sure if that's an accurate representation of the workload they have today. It seemed busier than usual, visibly looking at the traffic.
So tomorrow morning is when we start to get our testing numbers in from the previous day from all the sites. My guess is that there wasn't a lot of activity Sunday or Monday there, so they probably are having a busy day today.
We're getting a lot of concerned emails about what's going on at Chick-fil-A. What can you share about that situation?
They had a positive case, and I think you might have had some employees under quarantine. We're comfortable with the investigation and the exposure to the public. I think you have a proprietor who, shut it down for a little bit while waiting to get some of his employees back, and to clean out the facility. So I think it shows you how fragile business is to this virus, where if you don't have a heavy staff and you get one or two of your employees who get it, and then you get other employees in a quarantine, tough to operate. So that's kind of an example for how a small business can be impacted by this virus with just one or two employees. In this case, I believe it's just one employee. So we've certainly had lots of other businesses that have had one employee. This proprietor made a decision to shut down for a period of time.
Is that always up to the business owner,
Yeah.
or does the health department give guidance to a restaurant, food handling, very busy with customers?
If we saw outbreak in a food facility that would lead us to probably other concerns other than related to COVID. Remember, we regulate these restaurants on many different ways. So this case, there's nothing really. We feel very comfortable. The proprietor, had a situation where he had one positive employee, and they had maybe a couple other employees in quarantine, and he made a business decision. It's better to shut down for a week or so, or however long. We did not tell them they needed to shut down, and my understanding is they've worked very, very well with our health department. Yeah, we thought that it's important that with those a facility like Destiny that the phases merit the opening, and so it looks like many of the retail stores within that facility will be able to open. Again, I think the challenge with that type of setting compared to another retail setting is, are people, how many people are going to go based off of crowds and anxiety with crowds. On the front end of this, we didn't shut that down first. We shut it towards the back end of it because if you have been in Destiny, you know it's one of the easier facilities indoors, probably anywhere you'll go to physically distance. So certainly the restaurants outside of curbside and the entertainment types of stores will not be open in phase 2, but if you have other retail in phase 2, they'll be able to open up. Yeah. Yeah. Well, the physical distancing is still going to apply, and that's going to probably be the challenge with that. And again, it'll be interesting to see. I haven't talked to the management team. It'll be interesting to see what kind of demand they have from their tenants to want to open up, because if you think about it, if you don't get enough foot traffic, it's probably going to be a lost leader for the businesses to open up. So we'll have a conversation. We've seen their restart plan as far as the healthcare and the guidance, looking at masks and various PPE and but to your point about making sure this doesn't become an area where people are hanging out, that was the concern from when we shut it down in the beginning, was that people will be there hanging out and it'll be very hard to regulate the physical distancing. So we're going to have a conversation with them about that. Yep, they gave a plan to us asking for feedback on what it looked like, and so whenever we have that for a major facility like that, we have our health department review it to make recommendations and strengthen it, and then we give it back to them. So I've yet to talk to him myself, but I know our teams have been speaking.
We've seen you keep county parks open for mental health. Some of these additional properties like the zoo, Oneida Shores, good for mental health. Do you see the mall fitting into that, or do you want to avoid? Do you want to warn people against going to the mall for a mental health purpose, more for essential business and in and out kind of shopping?
Yeah, look at I'm not going to tell people where and where not to shop. These are all businesses that we should all support. So certainly you're not going to Destiny to hang out. That's not what Destiny is right now. So you're going to Destiny to go buy some summer clothes for your kids, or go buy this or buy that. That's what you're going there for. This isn't a spot to drop off 6 or 7 teens to go hang out for a day. We're not there yet. At some point, we'll be there. That's just not where we are right now.
You've been an advocate for car dealers and different things, and obviously you've talked about personal training reopening sooner than gyms in general. Other regions or states across the Northeast seem to be opening outdoor dining. What do you think of that?
Yeah, I think it's something we can do and we should test. That's there. I'm of the belief that it's better to phase in opening things that will have density. And so we have 3 phases left. And by doing that, even if you're allowing a business to operate in a limited capacity, you're giving this business an opportunity to make a living. And many of these sole proprietors can't qualify for PPP loans. They don't qualify for unemployment. And now you're running on 70, 80, 90 days, no income. Not a good situation. So certainly we think outdoor seating at restaurants, we'd be supportive of that. In phase 2, potentially, we've talked about this with the state. Nice way to, if you keep the governor's order under 10, maybe that's something that can be done. I know that many of the industry groups with restaurants are pitching a similar concept. So it's better to phase things in and test it, especially when we're testing the health data of the community, than to go all of a sudden from 0 to 100% capacity. We think that phasing it in gives you more information and more data.
I remember asking you about Heritage Hill, the Palladino farm property in Pompey, and that was his exact pitch, what you just said you were open to. Is that a change in thinking that now we can allow outdoor dining? Because it wasn't the case.
I think he's pitching that phase 1, right? So what do we have now? We have how many days worth of data after we've brought more people back together. So we've done that, and certainly the data has shown that the numbers, the increase in spread numbers is limited. If we weren't doing the robust testing in nursing homes, many of those cases we probably wouldn't know about. So it's a good thing we know about them now, and we can deal with those. So I think when the data shows that maybe that's something you can move forward from phase 3 into phase 2, especially when other states have opened up outdoor seating in the nice weather. And experts like Dr. Gottlieb have all said that outdoor dining at restaurants probably some of the safest way to do that. So it's all about being able to do things safely. And when we know, because we learn a lot in a week, that we can do things safely, and it might be in a different phase, but we can do a piece of that safely in phase 3 or phase 2 instead of phase 4, or phase 2 instead of phase 3. If we can do it safely, why aren't we doing it? And those are the types of conversations that we have. Yeah, so I spoke to the bishop last week. We talked about Pentecost, and I know I haven't heard exactly what types of services they're doing, whether it's going to be the outdoor services. The state has given guidance. The federal government has given guidance. They conflict. That's a challenge when you're the enforcement government in this scenario. So we've asked, we brought that up today on our call with our state partners, and said I would appreciate an understanding that there's 2 different guidances out there, and if it doesn't become clearer on what's what going into this weekend, we're not quite sure what we're going to do. But certainly we do not want to be in a position where we're being asked or people are calling in for physical distancing complaints in churches, mosques, or synagogues. That's just not a fair position to put the local governments in, because there's 2 separate guidances from 2 larger governments than us. They're going to go back and, bring back the message. So we'll wait. Hope we got a little bit of time. Other questions? Okay. Well, thank you all. And everybody, let's enjoy the rest of the day. This 93-degree weather, only here in central New York, only the best weather that we can ask for.
Do I have to ask the question again? Do you have good news? Are you trying to
Okay,
get out of that?
I think we've had a lot of good news. We're marching towards phase 2, and we're a nice little week of weather here. So there's a lot of good things going on, and it's our community is being tested at different points in this process, and we're performing well. And we just, as painful as this process has been in so many ways, the good news, fortunately, always